Hi, I'm Liz. Really nice
to meet you, Liz. Nice to meet you.
How's it going?
I'm good. Thanks a
million.
million.
Nice handshake too, which is a big bonus. So listen, how does the Lithuanian man from Kaunas end up in Carlow?
In here?
Yeah, how did that happen?
I graduated in Lithuania, actually. My college was in Kaunas in 2004, and after that I moved to Ireland, and most of the time I was working in Dublin, and after that the time came for a change. So
how did you find Brenda?
How did I find Brenda? I live in Silence myself, it's right beside Naas.
Yeah.
And I was sending my CVs around and everything, and Brenda replied me. That's how it was.
And how long are you working in Carlow?
In Carlow, I'll be nearly 1 year. I started last year in January.
Ah, okay. So previous to that, you were in Dublin?
Previous to that, I was working with HSE, actually, and I was in Dublin. Yeah.
So look, the Pembroke Dental Clinic, it's my first time here, and everybody I've met, whether they are dental nurses or dentists, or even your administrative staff, it's a really, really lovely bunch of people.
Exactly. That's what I liked as well, why I prefer to choose this place and stay in here, is because I found the atmosphere. It's a lot of staff, and you get into that friendly atmosphere. It's many people, they communicate together, they help each other, you can always feel the support, and that's what atmosphere you want, actually. That's how the patients find it when we walk in, and we see that and they feel that.
No, you can feel it, like for sure here, that it's very open and very caring, and that everybody's equal. Did you always want to be a dentist?
I was, when a child, I was always very fond of fixing things, So at first I was fixing my toys, everything was get fixed.
The same thing.
Oh, did she?
I loved fixing small things.
Exactly.
Yeah.
And later on, when I was growing up older, I was fixing the bicycles. I was dismantling, oiling, building back again. After that, household appliances, everything was brought in to me to get fixed, but in the later years, and when I was in school, I became very fond of anatomy, of biology, how the human body works, how all the system combines and everything. So finally I decided how to join those things together. And here I am.
Brilliant.
I'm a dentist.
So what, in terms of your everyday work, is there anything that you enjoy most particularly?
The most enjoyable thing is when the patients are leaving after the appointment, and you can see the smile on the face, and when they say thank you. Well, not everybody may say thank you because they're numb, and it's hard to say thank you when you're numb, but it's when you can see it in their eyes that they're happy with the appointment, they're not nervous, they're smiling, and especially when they're coming back smiling. I think that's the greatest reward. It means that you've done your work right, that they are happy, they are satisfied, and that leaves a satisfaction to myself too.
And I suppose in general dentistry, right, you see different cases all the time, so there's different needs from the patients coming in all the time, and then if you went down a more specialised route for whatever reason, or if you wanted to, you're kind of cocooned into that specialised area. Do you think that you will remain as a general dentist, or have you any ideas about specialising further? My
interest would be in aesthetics and restorative dentistry. So it's all about the look, it's all the aesthetics. It's giving back for people the confidence that they deserve, basically. It's the smile puts so much on the everyday life.
It is fascinating.
Exactly.
I've learned a lot today, actually, to be honest, about people. Yeah, no, genuinely. I genuinely learned a lot. No, just somebody said something very specific. They feel that they're being judged because of their teeth, and because they can't smile, they feel they're being judged. And I never thought about it that way.
Exactly.
Ever. And that's quite sad, really.
Exactly.
Isn't it?
And you can also notice the difference in people themselves when they come in, and at first they have the fear of smiling, talking. You can see they're using their hand to cover the face a bit, and after that you see the difference, and the whole appearance changes as well. They're all chatting, laughing, and you can see they're happy.
You sit in a different way.
Exactly. The whole appearance, everything changes.